always like this one with the cherry blossoms. But, so, updates. I'm going to try to come on more. Maybe I'll do a whole series on the medical trauma that I've been through. Oh, wait till you hear about the palliative. But anyways, I'm currently without palliative because of it. Because I canceled the other one thinking this one was going to take over. And it's been a bloody mess. My advocate asked me what I want from palliative. And quite honestly, it's having somebody hopefully that can come out in a crisis. I know they can't always. But they can even just advocate for me in a crisis. And I don't know. But anyways, and there's grief, goals of care. Doctors respond differently when you say you're palliative. They understand why you don't want to go through a crap ton of testing. Can't go through a crap ton of testing. All of it. I'm still doing the Recover patient representative stuff, and I'm actually going to be published. I'll have to post a link when it actually happens. I think it's under final review. It's going to be in some rheumatology journal. Amazing team I worked with for that. I can't speak much about it right now until it's actually published, but an amazing team. And it was actually from Brigham Women's rheumatology, which in the past, that department I have not had a good experience with, but I think it matters which doctors you get. I really should do a Dear Brigham's, a Dear Brigham, MGB video. So I saw movement disorder. She's like, I don't think you have classic dystonia. I'm like, I never said I had classic dystonia. But that's a whole other, again, maybe I'll do a whole, medical trauma, etc. thing. I don't want to start crying again. So we've been trying to develop and I wrote a whole memo to Brigham Women leadership about the COVID recovery clinic. And there have been some changes made, so that's good. I can't wait to talk to Julie and hear more. But we have gotten to the point that we have just named ourselves the Independent Advocacy Council of Brigham Women's CRC patients and caregivers, because they won't help us develop a patient advocacy council so far. But we have been doing a focus group. And all this I'm doing from bed. And yes, I'm overexerting. And now OT's coming out again. But I had to do that after the whole palliative eval. Again, I guess I'm supposed to tell you what happened. So I canceled home health and hospice because they just were too far and were unable to come out and to see me. Tufts has a recovery center, so they do the hospital itself. Not talk about Tufts Little General, which is technically what the home health is through, but Tufts itself. So I expected at least some knowledge, like MedBridge has, in case there's any home health rehab providers out there, or outpatient at home rehab providers, or just rehab providers in general. I know a lot of them use MedBridge. MedBridge has 2 long COVID modules and an ME CFS module. Just a heads up. I do not know how good they are because I do not have access to MedBridge. But, and I've made a whole clinical resource document that I can give to people that has links and all that stuff. And of course, Bateman Horn Center is like number 1. And then Mount Sinai is number 2. Their guide's a little harder to digest. You have to skip around and stuff. It's more thorough though. So they both have their pluses and minuses. But Bateman Horn has wonderful They have a whole rehab section, the whole 9 yards. Please don't mind my moon face. I'm still on prednisone for adrenal insufficiency, and the reason why we're doing prednisone is to help with the inflammation. But I'm doing adrenal labs next week, and hopefully they are high enough that we can just schedule an ACTH stim test, and I can hopefully get off prednisone, or you even just lower it to 2.5 milligrams and get some of this weight off between the Lyrica and the prednisone, and probably inflammation swelling because my CRP is 114 again. So anyways, test palliative came out. F's at home. Palliative came out. And the intake was put in wrong from the get-go. They put in chronic osteomyelitis. This nurse practitioner, made up an assessment that I've had chronic osteo, that I've been on multiple antibiotics, and that I didn't believe it was gone because I'm in severe pain, which I was at the time. I think I had rebound inflammation, so cephalosporins actually have a anti-inflammatory effect, and this is now my second time experiencing this, and I think I had major rebound inflammation. The last time was with the lung nodules, which those are gone. So the antibiotics worked, or whatever happened worked. There is question if that's where the osteo came from, but anyways, and we still have no idea where the osteomyelitis came from. So I'm trying to figure out where it was. Sorry. So she came out, she wrote a whole note about chronic osteo, that I don't have chronic osteo. And she actually called my PCP and said I walked across the room. My printer is 3 feet away from my bed. I literally can take pivot in one step. And I did the same thing to the OT today. The other day, I pivoted in one more step to hand her the papers. It literally, I was short of breath and in pain the whole time. So that's why I had OT come back out, so things can get documented properly. Because she called my PCP and pretty much said that she thinks I can do more than I said I can do. I've been pushing myself to walk to build bone in my back, because that's the only way to build bone in your back is to walk. She wrote that I prefer to be bedridden 20 hours a day. Who the fuck prefers to be bedridden 20 plus hours a day? I would do anything to leave these 4 fucking walls. I have filed multiple complaints. My medical record has been corrected, I guess. We'll see. My PCP knows me. I'm working on weaning the diazepam. That fucking sucks. Let me excuse my language. I'm just exhausted. In between this, like right before this palliative visit, I lost pain management due to ineffective therapeutic relationship because I would not do buprenorphine. I am on 5 Vicodin every 1 to 2 months, and it's only for transport to go to appointments or severe, like if I have a severe PSH episode from pain. He couldn't answer my questions about the liver or autonomic dysfunction or how it would affect ME, CFS, or anything. And because I asked for trauma-informed care, I was dismissed. And this happened right before this MP came out. Again, I really need to make a series on just the medical trauma since October. Oh my God. I'll sensationalize it. So, palliative came out. They still haven't answered my question that if they got an appropriate referral, will they do a palliative eval? Because my only other option is somebody who's out of network, and I'm going to need an out of network.